Hi everyone, good day. I am Karlya Asperela, a student nurse from Medical Colleges of Northern Philippines. And today, I'll be demonstrating the assessment of the cranial nerves. For the procedure, first we must perform hand hygiene and put gloves on if necessary. Then, prepare the necessary equipment such as salt, printed material, cotton swab, pen light, ice, sugar solution, tongue depressor, gloves, ice, and paper towel. And then prepare the working area. So, the next step is identify the patient and explain the procedure to the patient. Good morning, ma'am. I am Karlya Asperela and I'll be your nurse for today. May I know your name and birthday for verification, ma'am?
Angel Asperela, January 15 po.
Thank you, ma'am. So I'll be assessing your cranial nerves, ma'am, and this is for us to know if there are any abnormalities present. I'll be touching some part of your body and there are some movement that you should follow. Is that okay with you, ma'am?
Opo.
Thank you, ma'am. So, let us move to the working phase. And we will first be assessing the cranial nerve 1 or the olfactory. So, Ma'am Angel, I want you to first clean your nose. And next is, I want you to close your eyes and close one of your nostril. Ganito po. And pwede niyo po bang amuyin to para sa sakit?
Alcohol po.
Thank you, ma'am. So, the patient is able to describe the odor. And next is, let us proceed to the assessing the cranial nerve 2 or the optic. So, we will be first test the visual acuity of the patient by using and putting the Snellen chart 6 meters away from the patient, testing each eye separately. If the patient uses eyeglasses, ask them to put them on and then ask the patient to read from top to bottom until she can no longer distinguish the letters. Ma'am Angel, I want you to cover your one eye and then read the chart over there. Can you read this, ma'am?
DEFPOTEC.
Thank you, ma'am. How about the other one, ma'am?
DEFPOTEC.
Thank you, ma'am. So, after the visual acuity, let us also test for her visual fields. Ask the patient to cover one eye and look directly to her opposite eye. Shut your other eye and wiggle fingers in each of the 4 quadrants and ask the patient to state when the fingers are seen. Ma'am, could you cover your one eye, ma'am? Yung isa po, ma'am. Thank you, ma'am. So, the patient can see 20/20 near, 20/20 near, and far vision. So for the third assessment, let us check the cranial nerve 3, 4, and 6, or the oculomotor, trochlear, and the abducens. So let us check the pupillary reaction using the pen light, then observe for the direct and consensual reaction. Next is place your fingers about 10 centimeters away from the patient's face, then observe for the pupils dilation. Ma'am, can you stare at this one? Thank you, ma'am. So, lastly, check for the extraocular movement in the 6 cardinal direction of gaze. So, ma'am, I would like you to stare at this and then follow its direction. Thank you, ma'am. So, for the ocular motor, the pupils are round, equal, and reactive to the light and accommodation. So, for the trochlear, both eyes move in the direction indicated as they follow the examiner's finger. And for the abducens, both eyes are move in coordination. So let us move on to the fourth assessment, which is the cranial nerve 4 or the trigeminal. The mandibular, maxillary, and ophthalmic division should be tested symmetrically for the pain, light touch, and temperature. So for the pain, use a accusative sharp, then ask the patient to close her eyes. So ma'am, could you close your eyes for me, ma'am, and tell me if the pain is symmetric? Is the pain symmetric, ma'am?
Opo.
Thank you, ma'am. So next is to test the light touch using a cotton ball. Could you close your eyes, ma'am?
Ito po. Ito po.
Thank you, ma'am. So next is I want you to clench your teeth, ma'am. Thank you, ma'am. And then I want you to open your jaw against resistance of my hand, ma'am. Thank you, ma'am. So next is let us check for the corneal reflex. Could you open your eyes, ma'am? Thank you, ma'am. And next is put the fingers between bottom lip and chin, then percuss. So the patient feels the touch and pain symmetrically, then her jaw can open against resistance and can clench her teeth, and corneal reflex is good and there's no presence of jaw reflex. So let us move on to the fifth, and it is assess the cranial nerve 7 or the facial. So normally the patient can do these maneuvers easily. So ma'am, I want you, could you smile for me, ma'am? Could you show your teeth, ma'am? And could you puff your cheeks? And and press your lips. And then raise your eyebrows. And then could you close your eyes tightly against resistance, ma'am? Thank you, ma'am. So as you can see, the patient does the maneuvers without difficulty. And for the sensory function, let us test the patient's sense of taste by dipping a cotton swab on a vinegar and dipping it on the patient's tongue. So, Ma'am Maria, could you please open your mouth and stick your tongue out and tell me what the taste of this?
Asin po.
Thank you, ma'am. So, the patient is able to identify the taste. So, next is we will assess the corneal reflex. Could you open your eyes, ma'am? So, corneal reflex are good. And next is we'll be assessing the globular tap. So, globular tap is absent. Let us proceed to the sixth, and it is assessed for the cranial nerve 8 or the vestibular cochlear. So this is to test for the hearing. So test one ear at a time and occlude one patient's ear with your finger. So stand 1 to 2 feet away from the patient and conceal your mouth to prevent delivery breathing, then whisper a word. So, Ma'am Angel, I will whisper some words and you will tell me what you have heard from me, ma'am. Is it okay, ma'am? Could you occlude your one ear, ma'am?
Happy birthday po.
How about this one, ma'am? Could you occlude?
Apa?
Merry Christmas po.
Thank you, ma'am. So, next is to test the lateralization using the Weber's and Rins test. So, Ma'am Angel, I want you to tell me if you hear the vibration on one ear or both ears, ma'am. So, assuming that this is a turning fork because I don't have one here, ma'am.
Opo.
Could you hear it? Could you hear the vibration, ma'am? Both ear po, ma'am?
Opo. Opo.
Thank you, ma'am. So now let us perform the Rins test to compare for the air and bone conduction.
Opo.
Could you hear both ears, ma'am, or one ear lang?
Both po.
Thank you, ma'am. So as you can see, the patient can hear the whisper words and the vibration. So let us move on to the seventh, which is the assessment of the cranial nerve 9 and 10, or the glossopharyngeal and the vagus. So first is ask the patient to say and observe the palate and the uvula. Ma'am, could you say ma'am?
Ah.
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 And next is test for the gag reflex. Could you open your eyes, ma'am? So next is ask the patient to swallow, and this should be done without difficulty and regurgitation. Ma'am, could you swallow for me, ma'am? Ulit po, ma'am. Thank you, ma'am. So the patient can swallow without difficulty. Then lastly is to ask the patient to puff her cheeks with her lips tightly closed, then feel the air escaping in her nose. Ma'am, could you puff your cheeks, ma'am? And press your lips. And next is, and for the glossopharyngeal, gag reflex is present, and for the vagus, the patient can swallow and can breathe in the nose while lips are closed without difficulties. So let us proceed to the 8th, which is the assessment for the cranial nerve 11 or the accessory. So, ma'am, could you turn your back to me, ma'am, and I will move some part of your gown. Is it okay with you, ma'am?
Opo.
Observe any muscle wasting or muscle hypertrophy. So next is check the patient's can shrug and turn head with the presence of the resistance. Could you shrug for me, ma'am? Could you turn your head dito, ma'am? How about this one, ma'am? Dito, ma'am. Can you shrug for me again, ma'am? So, the patient has no muscle wasting nor hypertrophy, and she can shrug and turn her head even with a resistance. Dito na po kayo. So, let us move on to the last assessment, which is the assessing for the cranial nerve 2 or the hypoglossal. So let us observe for wasting, fasciculation, and involuntary movement. So ma'am, can you stick your tongue out, ma'am? Can you move your tongue side to side, ma'am? Dito po. Thank you, ma'am. So, can you press your tongue against your cheeks, ma'am, while apply pressure from the outside, ma'am? Dito po. Thank you, ma'am. So, also assess the speech and swallowing of the patient. Can you speak for me, ma'am? Speak, ma'am. Magsalita po kayo.
Hi. Hello.
Could you swallow for me, ma'am? Swallow po. Thank you, ma'am. So, as you can see, the tongue is in the midline and can move without any difficulties. And the speech and swallowing of the patient is also good. So, for the closing phase, document the findings of the assessment, then perform hand hygiene. And lastly is help the patient to a position of comfort.